Sri Siddhartha Medical College, Tumkuru. Today, I am very much thankful for Baby Chakra for giving me an opportunity to have a conversation and on talk of the topic thermal regulation in newborn. Coming to the topic, thermal regulation. When we talk about thermal regulation, the newborns are very much they are immature to maintain their body temperature. They can maintain body temperature only in the only little range. So what we should do is we should give the thermal neutral condition to make the baby comfort. This thermal neutral temperature is very normal, very little range. It's between the baby should maintain between 0.5 to 37.5. So anything between below 36.5, we call it as hypothermia. So anything above 0.5, we call it as hyperthermia. So normal range is 36.5 to 37.5, and smaller the baby, and there is the greater the risk. So we should be more cautious in the ward or in the hospital or in the home. So if you give proper condition, that baby can maintain its temperature. Whenever the baby is or the fetus is womb, it is surrounded by a temperature of 38 degrees Celsius. But immediately after coming out, it is exposed to a very so that baby start losing its heat. There are generally there are 4 where the baby can lose heat. Its heat is one by evaporation, second is by conduction, convention, and fourth is by radiation. So what is evaporation? The baby is surrounded by the amniotic fluid. So or if you consider any fluid, when the baby is covered by the fluid, wet is anything wet is there, it has the heat to loss through evaporation. And I told second one is through conduction. Conduction is if the baby is kept on colder surface, it's the baby start losing its temperature. And convection is when there is a cold air movement inside your room. So this cold air movement can also cause baby to lose its temperature. And radiation. So if in the room, if it is colder object is like almara is there, or any which is colder than the baby temperature, the child start losing its temperature. So these are the ways through which newborn babies can lose temperature. To maintain this, what we do is a warm chain. There are 10 steps to the warm chain. This is like not at birth, even in your home, you should maintain these steps so that baby is not too cold and not too hot. Out of these 10 steps, see, the room temperature should be not more than, sir, should be in such a way that it should not cause more heat or more cold to the baby. So what we ideally advise is that would be between 25 to 28 degrees Celsius. And this is the first step. And whenever the baby is wet, you should make sure that you wipe the baby with dry towel. So, and preferably if you do with the pre-warmed towel. So if it is done, then there's I told no this evaporation point is taken care of. The third step is skin to skin contact. If you think that child is very cold, you can keep the baby on mother's lap or mother's on the mother's abdomen, so that there is if the skin to skin contact is there, it is one of the best way to keep the baby in a thermal neutral temperature. And fourth step is giving should start from starting. The fourth step is breastfeeding. Breastfeeding is Breastfeeding is the one of the best way to keep the baby warm. How? The best by giving the breastfeeding, you are giving the energy to the baby. On giving energy, the child will get the basal. It meant start to do its basal metabolic rate. On doing the basal metabolic rate, the child will generate energy, and it will also give nourishment to the baby also. So this is the way of keeping the baby connection problem. Fifth thing, appropriate. So you should give a clothing. Connection problem. I'm audible. Okay. So appropriate clothing and bed is very important to make sure that the baby is properly well dressed with cap with socks. So 25% of the body surface body's heat is lost through head only. So you should always cover the head in an appropriate manner. And another thing is one more important thing is you should not bathe immediately after birth. You can delay 2 to 3 days so that the bathing will cause us more, so it should be delayed as much as possible, at least for 3 days. Then it is the warm transport. Whenever you're transporting the child, you should make sure that your baby is well covered, and if possible, you can use skin to skin contact, and you can maintain that. And another ninth point is the resuscitation. Warm resuscitation, whether we it is in the ward, we will make sure that the warm is maintained. When if the baby is delivered in the home, they should not sprinkling water, cold water to stimulate the child, and should be a warm room should be warm. And this and the last, the training the mother and the family to make sure that the baby is maintained a warm temperature. So we are getting questions. How can I measure my newborn baby temperature at? Yeah, so you can manage the newborn baby temperature with several methods. What normally advised is the using the digital thermometer. You can keep the digital thermometer over the eye of the child and baby and keep it for few seconds, like 10 to 20 seconds, till it beeps. If if beeps, you should check for the temperature immediately. If it between 36.5 to 37.5, no need to worry. If it is lesser than that, you need to give the baby a comfort, as I told, giving the warm warmness. You should maintain the room temperature between 25 to 28 Celsius. And another way is you can do rectal temperature, but this is very risky. And other method is skin thermistor, which we can't manage. It is in the ICU setup. What we do is, and one more is you can use through your dorsum of the hand, touch the baby's abdomen and the feet. If abdomen and feet are same and it is warm, then no need to worry. If abdomen is warm and periphery is cold, means your feet is cold, the child is already in stress. If the abdomen and are cold, then the baby is already in mild, moderate to severe hypothermia. You need to visit the hospital immediately. So I got another question: what special care should I take for my baby 1 month during cold weather? See, as I the baby maintain their temperature with narrow range. Whenever there is cold weather, you should make more precautions. Like you can keep the room temperature between 25 to 28 degrees Celsius. So you can use the AC, but it should be in that range. Room temperature should be in that range. You can use the wall mount for that wall mount temperature measurement of the room, so then 2 degree Celsius. And what other thing you should do is you should keep the baby breastfeeding and never stop the breastfeeding for 6 months, and should be continued for at least 2 years. And you should always keep the baby close covered with 1 or 2 layer of cloth. And I already told it should be always covered, and hands and feet should be properly covered. You can use the proper clothing so that the child will not lose the eat from his body. And always you should know the signs of hypothermia. As I told, the signs of hypothermia can be many. It can be like use your hand and should check for abdomen temperature, abdomen and feet. And also what you can do is you can use thermometer to make sure that the baby is not cold. And if the baby is cold, what happens? If there will be peripherals will be cold, and there will be a bluish discoloration of the feet, and the child may start be lethargic. And other signs are like the child start having poor suck. The cry will be weak. You can see the baby is breathing very fastly. And if it continues, there will be a changes in the body, like skin will be edematous, that there will be hardened skin, there will be redness, and for a longer time the baby can bleed also. So on measuring the temperature, if any time less than 36.5 degrees Celsius, you can go to visit the nearby doctor after getting the adequate warmth. And another question is, my 3 month old feel a bit cold when I touch her, even after keeping her well covered, especially in the evening. Is it normal? What we know is normally there will be decrease in the body temperature in the morning, and by the evening there will be a increase. So if there is decrease in the body temperature in the evening, make sure that your surrounding temperature is normal. So what you can do is you check for the surrounding temperature, room temperature, maintain that. Even on passing the urine, the child temperature can, if the child is on the wet surface, you make sure that you surface, and you if you dorsum of the hand and check for the temperature and the feet. And still if you have doubt, what you can do is you can check through the digital thermometer, and also see for other signs what I told, like whether the baby's feeding is not good, or whether the child is taking is it lethargy, or the child is breathing fast. So you should see is important how the baby is reacting to you. Also should check, and if everything is there, even when the child is not fed, the child is having hypoglycemia, means blood sugar level is low, then have hypothermia. So you should make sure all those things, and if everything is normal, it is no need to worry, and you can start giving breastfeeding and see for after half an hour. If the child is cold and the temperature is 36.5 degrees Celsius, what you can do is you give the thermal comfort and reach the hospital immediately. And I got another question: how can I ensure that baby is feeling too hot or too are the signs? So too cold means the child is hypothermia. So too cold, I told about this thing on measuring the abdominal and feet temp with your dorsum of the hand. If it is too, if it is there in difference, is already the child is in stress. The other signs I already told, like the child lethargic, child can have a weak cry, the child will not respond to you, the child is having fast breathing, and there can be mottling. Mottling is there will be a change in the skin. There will be edema also. So if all these signs is there, you can think this is a signs of too cold. What are the signs of too hot? What is too? It's like hyperthermia. If the temperature of the baby is more than 37.5 degrees Celsius, call it as a hyperthermia. If hyperthermia is there, the child become irritable, and there will the child's state will be increased, and the child start having a increased breathing also. So irritability will be there, increased heart rate, beating, irregular breathing will be there, and the child face the redness of the face. And if you touch, there will be a dry skin. If this continue for a longer time, what happens? The child, and again in this case also, the child can become lethargic, and if it is continue for a longer time, it go for coma. So you should always make sure that the child is a comfortable temperature, and if it is, always reach the hospital in immediately. And what precaution should I take during hot summers for my newborn baby? So I told the child should be maintained in thermal nature. So even if it is too cold, even if it is too hot, it is not desirable for the baby. So what you can do is, if the baby, if the weather is too hot, what you can do is the room temperature in the range of 25 to 28 degrees Celsius, and should not too tight clothes. So what you can do is, if you feel the child is feeling discomfort or the signs of hypothermia, is remove the extra cloth what you have put, and always continue the breastfeeding timely. So more chance of dehydration with the hot weather. And one more thing is, what you can do is, if you are in doubt, you can always check the temperature with your digital thermometer. And on the where you place baby should be away from hot surface or sunlight. So ensure all these things in the summer, so that your child is not getting discomfort because of the hot weather. So these are all the basic things in this temperature regulation. We should know as a new parents. We should know in general. And why the child are prone is because the newborn have very large surface area. That is, the head is compared to the body. So they are more prone for development of either hypothermia or hyperthermia. Second thing is, they have very little subcutaneous fat, and what we call fat called brown fat, which is required for the each generation, which is very less in newborn babies. So that is the one of the reason. And other, the child is too sick, or the weight is less than 2.5 kg, they are more prone for development of this hypothermia, and it can develop in any climate. Like it can be in the tropical climate, it can be the cold climate. So these things can occur in anything, anywhere. And I told about the science, and I told how to rewarm. If you want to so you can remember that, ensure room temperature properly, remove the cloths, and replace with the warm cloths if the child is too cold. And you can give in the home level, you can give skin to skin contact and continue breastfeeding. And if it's still in doubt, you can directly the hospital without any uh, thinking too much, because if you continue the hypothermia for longer time, child can go for complication. So you should always, so for mother, what I give the you are the best doctor for your baby. So always make sure that the baby is comfortable, and you can do is, you can maintain the baby's method of reaction is through the cry and all these things, so you are the best doctor for the. So you should always take care with this small precaution. And this is what I want to know, tell about the temperature regulation in newborn. And anything, I think I have told about the solution. And if you have any doubt, we can consult me or any doctor. And we have a very called Baby Chakra, where you can get very well information. You can log in and you can ask question to expert anytime. And thank you for giving this up, and thank you.